Hey, what's going on, everybody? It's the Trading Chief, and today I've found a stock that just released an FDA date. It was something I've been looking at for a couple of days, trying to figure out when it was going to come. Last thing I knew, it was reported to come out in mid 2023, but it didn't have an actual date. And it just dropped news yesterday that it has a FDA advisory committee right here for Neffy. So we're going to take a look at this. And as far as I can tell, this stock it looks great. I mean, in the time that it's been trading in the last 2 years, it's never dipped below the oversold line on the RSI. Um, so yeah, it looks great. We're gonna take a look at it. Financials look good. They're posting where did I see it at? They had $270 million in cash, which is phenomenal because their market cap's only $680 million right here. $274.4 million in cash equivalents. So we're going to take a look at this one. I think it's going to be a great company to hold long term. Analysts are saying a strong buy for it, giving it a low price target of $14. So yeah, we're going to look at the upcoming catalysts on this one, and it's going to be great. So let's take a check. Let's take a look at it because I got the website pulled up. It says, oh, and I'm sorry, the stock ticker is SPRY on this one. And that's ARS Pharmaceuticals. They're based out of San Diego. This is ARS Pharmaceuticals, a biopharmaceutical company dedicated to empowering. La, 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 we don't care about all that. Announced that the U.S. Food and Drug Administration has scheduled a Division of Pulmonology, Allergy, and Critical Care Advisory Committee meeting on May 11th, 2023, to review the new drug application for Neffy. Neffy has the potential to be the first non-injectable epinephrine nasal spray medicine for the treatment of patients with allergic reactions or type 1, including anaphylactic shock. The FDA stated that the following regarding an advisory committee in its official pre-NDA meeting minutes received by ARS. I was just on the FDA website and I didn't see this the other day. So we'll check that out here in a minute as well. Um, the majority of patients with type 1 allergic reactions, including anaphylaxis, have limited to or unsatisfactory treatment options in real world community settings because of reluctance to administer or carry their injectable epinephrine pens or devices. President and Chief Executive Officer of ARS Pharmaceuticals said. The announcement to hold an advisory committee is in line with our historical interactions with the FDA over the years, and we believe a positive step towards the potential approval of Neffy. We are excited to have the opportunity to discuss Neffy with the FDA and advisory committee. Let's check this out because, like I said, I was just on there a couple of days ago and I didn't see it. And I'm on here all the. Oh, there is a new one. There's a new one there. Oh, look at that. May 11th. You can tell because I've obviously clicked on all these. Meeting presentation will be heard, viewed, captioned, and recorded by teleconference. The committee will discuss new drug application 214697 for epinephrine nasal spray, submitted by ARS Pharmaceuticals for the proposal indication emergency treatment of allergic reactions type 1, including anaphylaxis in adults and children 30 kilograms or 66 pounds. The FDA intends to make background materials and the linked whatever oral presentations. So it's going to be probably 4 p.m. by the time they're done. So it'll be in the after hours on May 11th. Because if they're doing oral presentations here, it's usually a freaking 7 hour long conversation about this stuff. I don't know how anybody can talk for 7 hours. Those individuals interested in making formal don't care about it. All right, so they don't have anything posted on this yet. Otherwise, they'd be like, hyperlinks down at the bottom that you can click on and read stuff from. So the advisory committee is an important aspect of review given the new route of administration for an emergency use product that has clinically efficiency trial feasibility issues. Additional experts with knowledge in systemic allergic reactions and anaphylaxis will be invited to participate in the advisory committee, and the FDA will not be planning to bring ARS application to an advisory committee if they do not feel the PKPD provided by ARS had the potential for approval. So, very high likelihood of approval based off this statement here, which I suspect is going to be a lot like EBS. I don't know if you followed my video on that, but it popped today off of the Narcan drug, the 4 milligram Narcan drug that they got FDA approved, and it went from $8 up over $10. Um, so good little jump there off of an OTC or over the counter drug approval. So that's basically what's going to happen with Neffy if it comes out. So right now it's trading. Where's my? Right now it's trading at $6.90 in the after hours. So I'm pretty sure you'll see it jump up closer to $9 or $10 once this is approved. And as we said, this is going to be on May 11th. So there's that. And I wanted to look at something else. There was kind of talked about it somewhere in here. I was reading one of the news articles. Hope I can find it again. This one. So it used to be Silverback Therapeutics. Or ARS closes merger with Silverback Therapeutics. So this is from November 8th, 2022. Neffy NDA currently under FDA review. PDUFA is anticipated mid-2023. This is also being reviewed by the MAA in the European Union. And it's basically saying the same stuff. Today announced the closing of its merger with Silverback Therapeutics. This follows the satisfaction of all customary closing conditions, including approval for the merger. ARS has designed and developed Neffy to provide injection-like absorption of epinephrine. If you don't know, epinephrine is artificial adrenaline. And a small, easy to carry, easy to use, rapidly administered, and reliable nasal spray device for the treatment of type 1 severe allergic reactions, including anaphylaxis, shock. With the needle-free administration, Neffy may help eliminate the anxiety and hesitation associated with using an epinephrine injection device. The company's new drug application NDA submission for Neffy is currently under the review of the U.S. Food and Drug Administration, which we now know is May 11th. ARS has also filed and cleared validation of a marketing authorization application with Europe, which is currently under the review by the European Medicines Agency. And then they go on to talk about how it's a good time, whatever. Post-merger stuff we don't care about. And type 1 severe allergic reactions are serious and potentially life-threatening events that can occur within minutes of exposure to an allergen and require immediate treatment with epinephrine. The only FDA-approved medication for these reactions, while epinephrine autoinjectors have been shown to be highly effective, there are well-published limitations that result in many patients and caregivers delaying or not administering treatment in an emergency situation. These limitations include fear of the needle, There's a lot of people that are scared of needles. Lack of portability, like especially young kids. You got a kid that's, uh, probably 9 or 10 years old or younger that's over 66 pounds. I don't know how much kids weigh. Um, whatever a 66, however old a 66 pound kid might be. um, yeah, fear of the needle. Lack of portability, needle related. Safety concerns, lack of reliability, and complexity of the devices. There are approximately 25 to 40 million people in the United States who experience type 1 severe allergic reactions. That's a lot of people. Of those, only 3.3 million currently have an active epinephrine autoinjector prescription. And of those, only half consistently carry their prescribed autoinjector. Even if patients or caregivers carry an autoinjector, more than half either delay or do not administer the device when needed in an emergency. So there's something to think about. This could potentially provide these 25 to 40 million people with something to uh, thoughtlessly be able to save either their family members or themselves if they have allergic reaction, bee stings or loss or whatever the case may be, whatever the action is. So just wanted to bring this one to your attention. I think this one's going to be a good uh, play to jump into. As I said, its financials are strong. They had I think it's a $14 million loss in the quarter. Fourth quarter loss, 14.4 million. EPS beat, but they had a $14 million quarter loss. And as I said, they had 270 something $1 million in cash and cash equivalents. So financials are strong. I think this would be a good one to hold long term, and I'm definitely going to buy into it before. So just want to bring this one to your attention. If you like this content, consider liking and subscribing. Come check us out on the Banking with Billy Discord, and have a good day. Appreciate you watching.